we will be,
This meeting is being recorded.
and this meeting is being recorded, just FYI. And we will also be recording the questions from the chat box. So if there's something that's not addressed during this Zoom session, you can always put in the chat box and we can address it later. I just wanted to also quickly say that this is a journey that's been 14 months long for us. We're new to epilepsy, and I dove in feet first, head first, all the things. My intention is not to reinvent the wheel. It's to collaborate with others out there that's pioneered and laid the groundwork for canine research, epilepsy research and support, as well as trying to collect and have reputable and clinical evidence-based research in one spot as well. And as I was looking through the different resources out there, I found there was one little niche that I didn't find on any other resources, and that's virtual support groups. Meeting a person and face-to-face and helps build that relationship and that trust. So I hope to do more of these, and we do individual Whine and Wags. I'm usually on Wednesdays once a month, but this is a glorified, I guess you could say, special edition because of November is National Epilepsy Awareness Month. So without further ado, I've taken up 3 minutes, and so I am going to be sitting here admitting people as we go on. The first up on our agenda, I'm going to share my screen real quick with you guys. And we have Dorothy Wills Rafferty. So Dorothy, hopefully your voice is able to talk right now, and I'm actually going to let you do your own little introduction, and I'm going to pull up some slides that you shared with me. Okay. And you can kind of cue me in on when to pull up the 4 different slides that you had sent me.
Can you hear me okay?
I can hear you, yes.
Great. I just want to start by saying that networking such as this is so important when you have a dog that has seizures or canine epilepsy. It's really important to have a place to go to get information, kind of like a jumping off point. For me, we all went through this, but it's nice to know, like, hey, you can come to 5 Sibes, you can go to Gibberish and get questions. You can compile questions so that you can ask your own vet, and it's basically meant so that you have accurate information. And it's also wonderful to have the support. We all know how lonely and scary this is when our dogs have seizures, so this kind of thing is very, very important. I just want to mention that at the end of this, both I will have any links or anything that we refer to today will be over on my 5sibes.com in the Live Gibbs Strong library, as well as on the Gibbserish page, as well as in Ruby's page and Jessica's and Jean Ann's. So I just want to mention that. A little brief history for those that don't know, my 3-year-old woolly Siberian Husky began having seizures when he was 3, and it was in 2009, and information was not easily accessible as it is today. So at that time I went on MySpace. That tells you how long ago that was, and I put out a note asking if anybody's dog had a seizure, because I had never seen one. And a lovely medical nurse from Texas, her name's Lori Dansby, she reached out to me, did not know me, and she actually was a wonderful guide, and she kind of helped me ask with questions to ask my vet. She gave me some guidance on the anti-seizure medications and things like that. My own vet team was amazing. Gibson's lead vet was Dr. Arnold Rugg, the founder of Kingston Animal Hospital in New York. And he was just so knowledgeable, and he was so open to discussing every single little idea I brought to him. And I brought a lot. And he was open to discussing them. And he and Dr. Beth Alden were Gibson's vet team, and we had a pretty amazing team of vet nurses and vet techs as well. And so with them and these as my contacts, and myself being a career photojournalist, I just made it my business to actually find out all the information I possibly could on canine epilepsy, how to understand the testing that I was getting results back on anti-seizure medications and holistic and alternative therapies, just so I could give, Gibson the best possible life. And this dog loved life. I mean, he was bigger than life. He just had this zest, and it was inspiring. So together we wanted to make it our goal to be an advocate for dogs with canine epilepsy. You'll hear us refer to them as epi dogs. We wanted to make sure the message, A, that dogs do not need to be euthanized if they get a diagnosis of idiopathic epilepsy. There are so many different things today to explore, from medications to therapies to different cares to help them have a best life. So that does not have to be the go-to recommendation like it was many moons ago. Dogs with canine epilepsy can and do live full, happy lives for however long we're lucky to have them. So they could do things that dogs without epilepsy can do. They can go skitjoring, they can go mushing, they can be dock divers, they can cuddle on the couch with us, they can go hiking. So they're pretty amazing. And C, we wanted to make sure that we create an honest, safe, and vetted library, or resource center, as I like to call it, where folks can go and get accurate information, accessible information, all in one spot. And that enter is the Live Gibbs Strong Canine Epilepsy Awareness Library. Because the internet's a bit like the Wild West, as we all know. So it's really important to know that the information that you're getting is true and accurate. And again, it's for a foundation so that you can compile your own questions and have discussions with your dog's vet about what is the best possible regimen for him or her. We have a great panel on here today, and I want to thank Tracy for hosting this and everyone for participating. It's very exciting to be doing this. We're so fortunate that we have Dr. Karen Munena and Julie Netafee from the Neurology Department and the Companion Animal Epilepsy Research Lab at North Carolina State University College of Veterinary Medicine. I know they're going to be doing a Q&A from a lot of questions that we have gathered over the past couple weeks, and they're going to discuss some ongoing clinical trials if they have some going on. So we're really thrilled to have them here. For me, I like to just briefly touch on first aid and triggers. First, the list of possible triggers or causes of seizures is staggering, and not all seizures are canine epilepsy. The most important thing to do, and I'll probably be reiterating this several times, is that if your dog has a seizure, please contact your vet immediately. While canine epilepsy can be deemed idiopathic or a no known cause, a good tip is to try and rule out some possible triggers. And I'm just going to kind of go through a list really quick on here. They could be illnesses, injury, brain tumor, foods. Some dogs have allergies to a lot of our go-to foods, which is like chicken and beef. There's food and treat additives such as gluten, rosemary, preservatives, dyes, and colors. With Gibson, I kept him gluten and rosemary free. There's medicinal side effects. There's vaccine side effects. They could have a thyroid imbalance or hypoglycemia, both of which Gibson did have. There's ingested, inhaled, or applied toxins, and that includes rawhide bones, flea and tick repellents, scented candles, room fresheners, perfumes, certain essential oils such as rosemary, fennel, sage, eucalyptus, spike lavender, tea tree oil, hyssop, wormwood, and camphor. And spike lavender is not to be confused with traditional lavender. Traditional lavender can have a calming, relaxing effect. And as always, please check with your vet before using any kind of essential oils or anything new. There's also a good informational site regarding essential oils and seizures, and that can be found at Canine Epilepsy Guardian Angels website.
DJ?
First aid, veterinary care is first and foremost, but what other things can we do to help our dog before, during, and after having a seizure? And we know that there are a lot of people who also live remotely, so they might not be within a riding distance or immediate distance of their vet, or they may need to do something until they can get to their vet. Again, place that phone call first to your vet. But Tracy has a copy of the bookmark, if you want to put that up, Tracy. This is a bookmark that I did that highlights some quick, helpful first aid tips. And these bookmarks are free upon request, and that info is on the graphic. I put these out through the Anita Kaufman Foundation, which is now under the Purple Day Every Day banner. And I was very thrilled that they took on canine epilepsy information under their human epilepsy organization. But according to the bookmarks, which are great if you want to get some free copies, they're great to stick one on the fridge, of course, in your books. If you want to hand them out to your vet offices, groomers, your shelters or rescues, these are great little handouts, because a lot of times when people are adopting dogs, they may not know anything about epilepsy or seizures, and this might be a nice little handout to help get them on their way. One of the first things, and we all hear it, and we all know it's so difficult to do, is to remain calm. When you see your dog seizing, it is very scary, it's very nerve-wracking, but if you could take some deep breaths and just kind of remain calm, it's actually good for you and for your dog. Put the other pets in another room. You can have the calmest, most wonderful mannered dog, but when they see a seizing dog, it can become very frightful for them, and they could actually go after the dog that's having a seizure. So let's keep everybody safe and keep them in their own rooms. Be sure the area around your dog that's seizing is safe and clear of anything that could hurt him or her. And think things like electric cords or knickknacks that could be up on an end table. So if they're having a seizure and they bump into it, could possibly fall down and hurt them. Block off stairways, especially when they come out of a seizure, they can experience temporary blindness, and you want to make sure you keep them safe. Keep your hands and fingers out of a dog's mouth. They actually don't need help doing that. You can actually get bit if they chomp down while seizing. They're not aware of that. If you're home, stay with your dog. Use quiet, reassuring tones. Pet their side. And again, I think this is just as much for the dog as it is for us, the pet parent. Cool them down with cool packs, fan, cool wet towels. When Gibson had his first seizure, all I had was a frozen loaf of Italian bread and a bag of frozen peas in my freezer, and I used them. Tracy's going to put up a copy now of my Where Do I Put the Cool Packs poster. And this poster has been vetted by Dr. Rugg, and I want to give a shout out to Camille Anderson for helping me recreate Gibson here in this poster. But you can see from on there where to put them, and I'm going to talk about that in 1 second, but the other things would be to time and videotape your seizure if you can. This is excellent information to turn over to your vet. Be prepared to transport your epi dog to your vet or emergency clinic, because as with me, I'm sure with many people, everything seems to happen after hours or on a holiday or a weekend. So for me, I had a car ramp, an extension car ramp that I used as a makeshift stretcher. I always kept on hand. Gibson weighed between 98 and 120 pounds at any given time. So he was a big boy, so I had to make sure I had a plan in place. Post seizures, give a few licks of natural vanilla ice cream, maybe some easy sips of water, followed by a protein such as cottage cheese or boiled or roasted chicken or mozzarella cheese, whatever your dog can tolerate, to help raise those blood sugar levels. Have an epi first aid kit handy, and I have a list of those items over on the Live Give Strong resource library, so you can go over there and check out some things. You probably have a lot of them already in there, but there might be some ideas that you might want to add a few things. And lastly, for me, where do you put the cold packs we hear so much about, and why? When a dog has a seizure, their body temperature can rise dangerously high. So during a seizure, it's mid to lower back or thoracic and lumbar vertebrae. So when I first heard that, I'm like, excuse me? So if you look at the poster that I created, it has been, it's where I called where the saddle would begin. He was a very big woolly dog, so finding his exact spot was a little bit more different than maybe somebody else's, but it basically, if you think about, if you put a saddle on the dog kind of in that area, and I'm sure we can even have Dr. Munena verify if I'm in the right area. But this is where it worked for Gibson, and as a general rule of thumb. The other thing would be to post, or I'm sorry, I'm getting ahead of myself, armpit areas. I call them the armpit, but it's really under the dog's leg. And that's where I laid my loaves of Italian bread. The other areas post-seizure would be tips of their ears to cool off, paw pads. And I did get Gibson what I called a cooler water bed, and he had that to use 24/7. I was hoping it would be a preventative measure because overheating and stress were two more Gibson's triggers. So he also had a double coat, being a woolly Siberian Husky. So I always was kind of making sure I was keeping him cool on warm days, or if I thought he was starting to act a little off and thought maybe he'd be having a seizure, I got him a cooler collar, and he quite often had one of those on. An added note would just be if your dog has been shaved or is not a double coated, like a Siberian Husky or Northern breed dog, and has a single coat, wrap a cloth around that cool pack. And as always, have plenty of fresh, cool water available for them to drink.
All right, thank you. A lot of great information in a very short period of time. The whole purpose is during this first half hour is to share resources and references. And then the last half, because I know some people had jumped on, is to then have those questions answered that we had submitted before or even in the chat. So thank you, Dorothy, so much. Dorothy and I have talked many times via chat, messenger, and text and email, but this is actually the first time that we are seeing each other. So it's nice. Anyway, so the next person I would like to introduce is Jessica with The Adventures of Rosie. So I am going to share her information here and get this going. Oops, I need to escape out of here. And Jessica, make sure you have unmuted yourself, and you can go ahead. And I know Jessica, said she was nervous. She's never Zoomed before.
Can everybody hear me okay?
Yeah, it's just talking to somebody else in a room with a whole bunch of little windows. So go right ahead and I will share your information.
Okay. Good morning, everyone. And thank you for this amazing opportunity and inviting me to be a part of this. My dog Rosie is a huge part of my life, and I have really just taken every opportunity I can to research and to find out more about this condition. Rosie's 5.5-year-old Labradoodle. I got her from the Pacific Northwest. And one day when we went to the park, it was just a normal day. And out of nowhere, saw some foaming at the mouth, some rapid eye movements, things that didn't seem normal, but I wasn't quite sure at the moment what was going on. So fast forward about a year later, after the vet had already done blood tests, everything came back normal. I thought, okay, maybe it was just some bad grass that she had eaten or something just along those lines. She was a puppy, so I had assumed maybe she had eaten something. And then fast forward that year later, we went to a walk. We just went for a normal walk down the street. And then out of nowhere, she started convulsing on the floor, on the ground. And that's when I knew something was definitely wrong. I was having flashbacks to that moment, that very first moment. So basically, when we arrived at the park, I was panicking. I was scared. I didn't know what to do. There, like Dorothy had mentioned earlier, there wasn't a lot of resources about this at the time. So I was a little overwhelmed. So I actually went on Facebook and I was searching dogs with seizures, anything I could come up with. And I found the Facebook page, Oh, the Life of Olivia. And I really confined in that page because it made me realize I was not alone. There was a lot of people actually dealing with this as well. And she had great resources for me as far as finding out what to do, having resources as far as talking to other people about this. And that really inspired me to speak on Rosie's behalf as far as her story and what she's been through, and hope that I could be also a voice for dogs who can't obviously advocate for themselves. And then since that last time that I talked about a year ago, Rosie in the last 4 years has had over 80 seizures that have been documented or seen. When I had first taken her to the vet, they told me, like Dorothy had mentioned, videotape it or document what's going on, the time, what's happening, what you did that day, things of that nature. So I compiled all of these different things that I've learned over the years and made a book in order to hopefully help myself and other pet parents kind of guide them and navigate them through these difficult moments. Also, I noticed whenever trying to travel, having a dog with epilepsy is extremely difficult. Trying to find somebody who is capable and knowledgeable about dogs with seizures is very hard, as well as having the information all in one place in case there is an event of an emergency. So my book was very pinpoint towards having all of that information in one place. So if you do need to have a pet sitter, somebody watch your dog, all of the information is in one place. All of your instructions, all of the what to do, all of the triggers and things of that nature to look out for, because it can be very tedious to have to write everything down and try and explain it all. Can be very involved. So I decided to create this book, and I used as many epi dogs as I could because I feel like when I look at that, it reminds me and hopefully others that they're not alone in this journey. There are a lot of people that go through this, and we can all do this together. And like Dorothy had said, despite the epilepsy, Rosie lives a completely happy, normal life. She loves to roll in grass. She travels. She loves to go out and swim. She has had so many different adventures. And I think it's really important for people to know not to live in fear. As hard as it is and as overwhelming as it can be, I think it's really important for people to know that despite the seizures, that if a seizure lasts only 1 minute and a dog has 30 seizures in their lifetime, that's only 30 minutes of time. You have so much time together despite that 30 minutes. And it's really important to remember that despite those 30 minutes of hardship, there's so much life to be lived for these dogs. And like Dorothy had mentioned earlier as well, euthanasia doesn't have to be an option. There's many medical options out there that could work for your dog. And there's other options if they don't. Holistic options as well as medications, acupuncture, something. So yeah, I love my dog so much, and I really wanted to advocate for her and other dogs as well, and really try and be an outlet for people like the Life of Olivia was for me, for people to come to and talk to. I'm not a medical professional, but I do want to be someone's helping hand when they're struggling like I was. So
Thank you, Jessica. And it's important to note too that Jessica is prominently on Instagram, which is great. So you can see her Adventures of Rosie, the Doodle, on Instagram. And she also has other books that she has written, Adventures of Rosie Going to Different Places. So check that out. And there are, so I appreciate you coming on and sharing your story with us as well. And speaking of the Life of Olivia, Jean Ann, if you are available and want to join us, you're next up. And I do have some screenshots for you. If you can say, hey, are you there?
I'm here. Can you see me?
Yeah, I can't see you, but we can hear you. Wait, no, I can't see you. There you are. Sorry. Hi.
Sorry. Hi. First of all, thank you so much, Tracy, for hosting this awesome event. And thank you to all the participants for being here today. This is a great event, and I'm really proud to be part of it. So yes, I'm Jean Ann, otherwise known as Olivia's Who Mum. Olivia was surrendered to a local shelter at 6 months old. I adopted her 3 months later, so she was roughly 9 months. She's 12 years old now, 12 and a half, I guess. And it was love at first sight. As soon as we saw each other, I knew that she was the one for me. So I brought her home, and she was great with the cats. I loved her. She jumped on my bed immediately and looked out the window as if to say, okay, I'm here, I'm home. My other dog, who was aging and grieving the loss, our Destabella, a wonderful dog who had passed a few months prior to Olivia arriving. He was grieving. And so Olivia really brought up his spirits. She was a joy, is a joy. So a few weeks went by before Olivia had her first seizure, and I was sleeping and woke to a kerfuffle and came out and found her just kicking and thrashing on the floor. And oddly enough, I had worked as an animal care supervisor in a busy Toronto clinic for a number of years and had seen seizures before, but the vets were there to deal with it, and I was only there to assist them in any way that they needed. So this time I was alone in the woods and miles from any vet emergency center. So needless to say, I felt really helpless. I was terrified. And so even though it only lasted a few minutes, it felt like it was going on forever. The very next morning, I called the vet and she suggested that we hold off, that perhaps it had been a reaction from Olivia's vaccinations, which she was given just before we left the shelter. And so she was vaccinated, given quite a few boosters. And so she did in fact have another seizure. In fact, she had what is known as a cluster buster or a cluster seizure. At the time, I was not aware of that term, but had learned that a cluster seizure is more than one seizure in a 24-hour period. After seeing her vet, Olivia was prescribed phenobarbital. I resisted initially after reading the potential side effects and long-term use. I didn't really want that for Olivia, but after Olivia having a series of horrible cluster seizures, my vet told me that each seizure Olivia had actually made it easier for another seizure to occur. So at that point, I agreed and we put her on phenobarbital. Soon after, due to breakthrough seizures, a second drug was introduced, and that was potassium bromide, which is common. Unfortunately, that wasn't enough. And later we had to put her also on zonisamide, which is a compound drug. It's a little more expensive, but it did seem to do the trick. So one of the things I would like to put out there is often I hear people saying the drugs aren't working. The vet is thinking that they should be euthanizing their dog. Don't give up. It actually can take months, sometimes years before you find the right cocktail for your dog. Every dog is different. What works for Olivia may not work for your dog. And it is best to find a vet who is well-versed in epilepsy or works with a neurologist. My vet did in fact consult often with a Toronto neurologist, so I was really fortunate in that respect. Olivia's on a fairly restricted diet. I don't allow people to give her treats unless they are fresh veggies. She loves her cucumbers, zucchinis, rutabaga, things like that. She gets some fruits. I don't like to give her too much because of the high sugar content, but she does love her bananas and blueberries, which she gets every day. And of course, her favorite, her liver treats, which I provide in a puzzle toy just to keep her active, because food is her one and really, now that she's older, her one true joy and stimulant. That's what she likes to do every night after dinner, is play with her puzzle toy, and the liver treats are a great source for her. And they are actually, from what I understand, good for dogs who have epilepsy. There did come out, so get back to the cluster seizures. So a fourth drug was needed in order to control Olivia's clusters. seizures. And so at first we used clonazepam, but after a couple of years of using that, it was no longer effective. And we moved to using Keppra, which we've been using for quite some time now, and has worked quite well. And I like that drug because it doesn't stay in the body very long, and she recovers from it relatively quickly. Although I do also use it as what is known as a prevent an event. So if I see signals that perhaps Olivia may have a seizure, I will give her her cluster buster as a prevent event, her Keppra drug. Initially, I was a little resistant, but after speaking to another epilepsy warrior, Humam, she really made the case for me that it was better to prevent an event than have to go through a seizure. So that became easier for me to accept that it was a good thing to do. One of the things I would strongly suggest to anyone out there is to educate yourself as best as you can on canine epilepsy. There is way more resources and information out there than there was, say, 10, 12 years ago. And participating in a community is really a great thing. You get to share experiences, and you learn so much from others out there. And supporting one another is a great, just a great thing to have in your toolkit. And having a protocol, knowing what your dog needs when they do have a seizure. For me, that means having ice packs ready. We use frankincense, which I put under her nose. It really does seem to help her regain consciousness a little quicker. Ice packs, as Dorothy already went over, so I'm not going to reiterate, but are super important, as well as ocular compression therapy, which I use if, again, I see any signal that Olivia may have oncoming seizure, and I use after she is conscious as well. And what I've learned in using ocular compression therapy is you can actually feel their eyeballs, the pressure behind them. So it's almost a way for me to gauge whether or not there is an oncoming seizure, because otherwise, if you do it when there isn't a seizure episode happening, you can just feel what their eyes feel like normally. And if a seizure is in fact oncoming or has happened, you can feel their eyeballs are, the pressure behind them is greater. So it's a good way to gauge also for me. And, that's been my experience. So it's a great tool. And again, that's a great tool to learn.
And Jean Ann, I appreciate, we're going to, of all the different things that you had brought up, the protocol, the ocular compression, and then having the prevent an event. So I think that there was a lot of questions that we had people come in with those. So I'm glad that you brought that up. And also the source of community as well. This is one of those scenarios. I mean, we're reaching out, we're talking. You're in Canada, right? I don't know where everybody else is. I mean, just think of all the people we're touching in all the different parts of the United States and across the world. So I do want to take a moment to, direct you guys to, Olivia's page, who obviously Jean Ann does a great job with the Wally Foundation too, which we're going to quickly talk about as well. So I hope you didn't mind that I shared this March event coming up, Jean Ann. And that is, helping create awareness on Epilepsy Awareness Month. And then, of course, visiting, you also have Naughty for gooddogs.com, which has a lot of hemp products. So we want to make sure that people are aware that you're involved in that as well.
Also have, so the hemp toys were something I wanted to provide a toy. A lot of toys have chemicals that they're made with, and even children's toys, baby toys and whatnot, after researching, was actually very terrifying. And the naughty toys, which are hemp rope toys, hemp material, soft toys, everything in the toys are hemp based. But I also have a Naughty Toys for Good Dogs blog, and there I write a lot of posts on canine epilepsy. You can also go there and find out more about ocular compression therapy, share videos that show you how to do this yourself. So, and the event that you shared earlier, the March, that's a prior event. So that's already happened.
Oh, yes, it's not 2023. Okay.
But it was a
Sorry
great
about
event.
that. But no, that's just an example of like the things that you guys have done in the past with, you know, getting people together. I know probably you'll do something in the future. This was an example as what, you know, we've done in the past as well, just to give you props about staying active in the community of epilepsy.
Yeah, being in the community is definitely a benefit for sure. Like I said, the support is wonderful, and sharing. You know, it's about giving and receiving, and it's a great. It's one of the best things about this experience, this journey that Olivia and I have been on, as most of you that are here as well are going through, and I would like to point out that also, as we've mentioned, meeting the people, this community, I've made some wonderful friends. It feels like family. It really, again, don't be afraid to jump in there and share your dogs and share your experience, because sometimes we think our experiences aren't worthy of sharing, but what we think is every day is amazing to others. So it is really a great thing to get involved in, and this epilepsy journey has led to my home-based business, which I really love. I love, and the Wally Foundation was something I fell into because with Naughty Toys for Good Dogs, I wanted to be able to donate a portion of the sales of the toys to something like-minded. And when I found the Wally Foundation, it was perfect. And then it turned out Rick was looking for someone to handle the social media component. And so that was wonderful as well. So I do sit on the board with the Wally Foundation, and also the director of social media. So, it's been a journey, and it's changed life. It's changed my life. But like Dorothy mentioned, and Jessica, Olivia's a joy. She's happy, she's smart, she's silly. And most of all, she really is a joy, the love of my life. And I really, one of the
and I will appreciate, I'm sorry for interrupting. I want to make sure we stay on track for sure, because I don't want to go into too much of the Q&A portion. So I would love to invite, I know this session is only from 12 to 2, but anybody else that wants to stay on, we can stay on for 4 hours, but whatever. It's going to be recording that long, but I didn't know if Dr. Munana, and I butchered her name, I'm so sorry, if they have time to stay extra. So I want to make sure we respect their time as well. So please stay on afterwards and we can chat. But I do want to move on to the next person. So I'm sorry, Jean-Anne, for interrupting you. I could talk to you all day long. So Lorraine, I've got your picture up here that I drug off the internet. I hope that's okay. But
thank you.
And then also some other pictures here from the site that I quickly Googled this morning. So we'll take a few minutes to kind of tell us a story, and then we'll kind of try to get back on track here.
Sure. Well, I'll tell you quickly. I'm a volunteer puppy raiser with Guardian Eyes for the Blind. And
Mhm.
Jackie was the 7th puppy that I raised for Guiding Eyes. And just before she was scheduled to go into training, formal guide dog training, she had a tonic-clonic seizure. And I recognize that because I have epilepsy myself. And I can tell you, all of the discussions, I had breakthrough seizures on multiple types of medication, finally found one that worked, and I've been seizure-free for 20 years.
Wow.
So,
yay.
and I can tell you too that from my experience, and I know that all seizures are different, but for me, I could hear my husband talking to me during a seizure, but it felt as though someone had their hand over my mouth and my eyes. So I kind of try to apply that to Jackie, and I continue to talk to her when she has her seizures. Jackie was sponsored by my employer, IBM, as an ambassador for a project that we have with Guiding Eyes for the Blind in North Carolina State University. And I used to take her to Washington, D.C. with me, and we actually walked the halls of Congress advocating for the positive potential of AI to benefit society, because we were working with Guiding Eyes in North Carolina State University on a project to discover what is it that makes a guide dog successful. So when Jackie had a seizure, and I shared that with my friends at NCSU, they said, you have to bring her back to North Carolina. We had been there several times on the project. We have a great veterinary school. There's a neurology clinic, and there's a companion animal epilepsy research lab. So I reached out, and Julie Netafee called me back and spent almost an hour with someone she didn't even know, who was panicking at that point, because your heart kind of breaks for the dogs. I have never seen myself have a seizure, so seeing it in a dog that I love was very difficult. And because she at that point was not my dog, I was working through Guiding Eyes, who technically owned her, and the neurologist that they had sent her to. So I really appreciate Julie's information. And I did take Jackie to North Carolina State University. And after her appointment, I was talking to Julie, and Jackie had a seizure. And the compassion, Julie was on the floor with Jackie and I, and at 4 minutes, she called Dr. Munana, who came out with multiple people, and they whisked Jackie away. So I couldn't have been in a better place for her to have that kind of seizure. Jackie was heavily socialized. There's a lot that goes into preparing a dog to become a guide dog. And she had done a lot of socializing, done a lot of events. When we went to North Carolina, we were on all of ABC, NBC, CBS. They all did stories on the project and the work that NCSU had done. So when she was diagnosed with epilepsy and it was determined that she could not become a guide dog to a blind person, I thought about, well, what else can she do? I have epilepsy. IBM never got rid of me. My husband didn't divorce me. and Guiding Eyes were willing to rehome her so that I could continue raising puppies. But having epilepsy myself, I just couldn't put her through the stress of going to a new home, and myself through the stress of not knowing what would become of her. So I adopted her, and she's had 20 seizures, but I would say that I log the seizure frequency and duration, and the frequency has gone down under Dr. Munana's care, and the duration has gone down, the duration of her seizures. So I'm very grateful for what NCSU has done, and I'm so grateful to be invited to participate in this forum and to hear about the experiences that others have.
Mhm.
Thank you.
I appreciate it. Thank you so much. That is, I don't think I've ever met anybody that both the human companion and the dog both having seizures. That's new.
I'm sure that Dr. Munana will tell you about the one medicine approach that they have, and the fact that seizures in people and humans are very similar.
Yes.
So I feel that Jackie has stayed an ambassador for Guiding Eyes for the Blind. She's still the IBM puppy. She's the mascot for our neurodiversity at IBM group. and she's still affiliated with North Carolina State University. In fact, the day after her appointment with Dr. Munana and Julie, we stayed over a day because she was working with the Department of Engineering and the College of Computer Science to do some gait analysis. So she's got an active, vibrant life. She's still helping people. She's still working. And I think that's the message. And I love what one of the other speakers said about 30 seizures is 30 minutes out of a life.
Yes, thank you so much.
Thank you.
Speaking of amazing dogs, my next wonderful, well, friend, I guess now, dog trainer and owner of beautiful Ruby the Therapy Dog is Jan, who is sitting right next to me, actually. Hello. So she is going to give a little bit of her history with Ruby, and then we will move on to our guest speakers. And I will. Oh,
I need to mute myself. Sorry. Ready?
Yeah.
Hold on. Hold on a second. You can just come over to my computer. Okay.
There we go.
There we go. Hi, everybody. Am I,
Yep, you're right there.
okay. You
Okay.
drive.
You can go ahead and go.
I want to thank everybody who mentored us and all of the good tips. I have books and tons of information to share that I'm willing to share with you. But just to wrap up the introductions, I really want to explain that I'm kind of on the other end of the journey. Ruby passed away in August. I still have tears every morning and wake up with songs like, "How am I supposed to live without you?" However, Rue was very special too. When she was diagnosed, she was already a therapy dog. And I had people tell me to put her down. I had the doctors tell me that it was hopeless. And I found a neurologist who studied epilepsy in dogs as models for people. And so I decided to launch into learning all I could. And Ruby is not letting me quit. I had planned a whole different discussion today, but she woke me up this morning. She dog tapes her messages to me. And she has what I think is a pretty profound, important message for all of us today. Near and dear to our heart is the fear and grief that goes with epilepsy. And if we're honest with ourselves, we go through fear and grief every time we experience a seizure. So now I want to address that big elephant in the room. And Ruby said to me, you know what? We're all out there fighting our little battles in hand-to-hand combat. We need to look at this as a war. And if you think about that analogy, it's so poignant. Every time we face a seizure or lose one of these warriors, we face fear and grief. And I see fear and grief as epilepsy's generals. So let's get together and organize our army. When you do battle of any kind, it takes knowledge and information and cooperation and a team and leadership. Anytime you think about an army, you have soldiers and medics, snipers and spies, watchers, generals, seasoned warriors, and each warrior has a buddy in their battle. We have strategists and financiers. This, most of us think of it day to day as hand-to-hand combat. Only in our battles, we never know when they're going to happen and when they're going to end. What are our arms and our what's the word? Our armory is knowledge and information, courage and experience and trainer. Sooner or later, we're all going to face the biggest fear in our life. Identify it, give it a name. Is it fear? Is it epilepsy? Is it a static seizure? And be prepared for that. And we all need to understand that things are going to happen that we're not prepared for. But the more we research and learn and talk, the more we can be prepared. The last time I took Ruby to ER, they asked me to sign a disclaimer. Did I want her to have CPR if she went under, or do I want to sign a do not resuscitate order? I was totally unprepared for that. However, Rue believes in courage. And I have a sign in my kitchen that says, fear knocked at the door and faith answered. Let's change that word to courage. And so when you find yourself in grief or fear, address it and get somebody on the phone, connect with somebody. We believe that as a community, we can win this battle. Let's declare war on epilepsy by coming together. Thank you.
And I'm going to switch places. All right, sorry about that, you guys. Multiple monitors and computers to make everything happen today. And I want to thank Jan. It did everything I can not to sit here and shed some tears with her because Ruby meant a lot to us as well. And I had a hard time with her passing. But Gibbs is hopefully going to help fulfill and carry on her legacy as a therapy dog himself, which he just passed his pet partner's evaluation test. We just got a registration letter. So we are, and I have to tell you, therapy dog Gibbs just came up and gave me some loving. Yep, when he knew that she was having a difficult time. So so that's another just another correlation and way to network. So I know we're a little bit over, and I'd like to now start with the Q&A, and then we'll end up talking about the Wally Foundation at the end. Munana is with us. I remember maybe it rhymes with banana. So sorry again. And Julie, I do have some questions that I have categorized into different segments, such as seizures, medications, foods, activities, and emergency responses. So I think that I've grouped all these questions together. So I think a few of those can be answered kind of in a general manner. And I just do want to preference that our vet experts here today are not providing medical advice. They are here to help educate and just talk about the questions in a general manner, and that you would always need to refer back to your primary physician as well. Maddie, sorry, we just gave the dog some bones, and Maddie's not liking Gibbs being around her. So, she took Gibbs's bone, but anyway. So I will start off with the first few questions, and then Julie and Dr. Munana, you can jump in and answer the questions as you see fit, and we can go from there. I am going to get started here. Just a second. And I'm going to share my screen with one of the greatest handouts that I found when I was looking for resources. And it is from North Carolina State University, of course, which I know you guys are completely aware of this handout. Has a lot of good resources on it, and if you guys want to kind of hop on and talk a little bit about this resource real quick, and then I will start with our first question.
Julie, do you want to talk a bit about the resource?
Sure, I'd be happy to. I first want to just intro and thank everybody for joining this program today, for Tracy and Dorothy for helping to organize it, and for the invitation to both Dr. Mignon and myself to take part. It's just been fascinating to hear everybody sharing so eloquently already. And we're just excited, although it's a challenge, we're very excited to be part of this. And so thank you very much. Thank you also, Tracy, for going ahead and pulling up this document. So one of the companion animal epilepsy lab at NC State, certainly we support research, education, and outreach for epilepsy, not just canine, but predominantly canine epilepsy. And we've had some just amazing supporters of this over the years as well. The PDF that is being shared is actually a project, one of our epi dogs that had come through that took part in multiple clinical studies, as well as took part in education of our veterinary students, Archie, and his mom loved education, loved helping clients and caregivers to be, as was just shared, you know, kind of that arsenal of, you know, being ready and being informed and educated. And this is just a way that we put together a lot of different topics in this PDF that is on our website. We'll share the link to the website maybe in the chat here so that everybody has that and can navigate. But essentially going through different aspects that'll hopefully be something you can put in your own toolkit to help you on a lot of different avenues, from your pet to yourself, and to you really be ready. You know, if we're getting set for a hurricane, right? We're in North Carolina, we definitely have them periodically and annually. And every single year for that, everybody sends out a hurricane preparedness kit. Well, all of you that have epi dogs know that, you know, we don't always get as much advance notice that a hurricane's headed your way, right, for your pet. And so just being ready, having that kit packed and ready, having some ideas. Many of the things that have already been brought up, from having your connections, and you guys are doing an amazing job in building this and building connections with each other, which, as we all know, one of the biggest hurdles is just not feeling alone in this battle and being able to reach out to others that have walked that path. And even though your dog's seizures may be different, may be handled different, you still have some familiarity with what is taking place, and you can connect with them as well. Thank you, Tracy, for posting that web link. So please come on to this website, which is ours at the college. They are doing some renovations, so it's in a bit of a changing format, but we have this PDF which anybody can access and share and use. We'd love to hear that. We have some resources on this as well. And also on our website, I'll just share that we have a link on a prior page, but it's a nationwide database of pets with epilepsy. And in kind of helping all of us, one of the great options we've had over the years are clinical studies for treatments for helping with caregivers, et cetera. And that database allows you to put your information in. If we have a study, we will and we're seeking particular animals, we will reach out to you. It's not a shared resource, but it is certainly, anytime that we can move a study forward quicker because we have patients already in the queue that want to take part, just means that, we can hopefully shift the dial. Does this treatment work? Does this modality work? Is there something about how we can support caregivers? So I'll just open with that, and thank you again for allowing us to be a part of this. It's really exciting. So.
Sorry for putting you on the spot about that. I just love this PDF, and I know you guys know it backwards and forward. There is a lot of clickable links on this as well that takes you to a lot of different resources. So I wanted to make sure that people knew about it. It's very easy to read. It is, it has, like I said, those direct links, and it gives logical and practical advice when you are desperate and when you're freaking out a little bit and scared about how to move forward in, taking care of an epileptic dog. I will go ahead and keep this up here just so people can see it and view it. I'm going to start with the category of seizures. It seems that there was a lot of questions about typical seizures. And so I'm going to ask them pretty quick because I know that some of them can be addressed in a few seconds. And then we can also kind of get a little bit more into some complex questions later. The first question I have is, why does one seizure often mean another and another? In words, why do they cluster?
So we don't really know why some dogs will have cluster seizures and others won't. But what we do know is that normally the normal mechanism for a seizure is all brains are capable of seizures. Our dogs with epilepsy just have brains that are more capable of seizures. And one of the real hallmarks of seizures is they start spontaneously and they typically stop spontaneously. And for whatever reason, in certain dogs that are prone to cluster seizures, or even when a dog gets status epilepticus, we know that stopping mechanism isn't working appropriately. So as to why, we don't know that, but we know it is something that we see, and it may be something that has to do with we believe idiopathic epilepsy is a heritable disease, a genetic disease, and it may have something to do with the genetics, which we don't completely understand yet.
Okay. And there was some mention about triggers. I know medically and then not known at all. And there was some questions about daylight savings time, fallback time, and also clarifying as something as medications that could possibly affect dogs with seizures if they miss a medication within a certain amount of time. Is there a time frame that like 15 minutes, half hour, hour? I know they were kind of wondering once if you miss a dose, and how is there a range, a safe range, if you can't get to your dog in time to give a medication?
So there's no specific safe range, and that's a very individual question, and it depends again on the dog's seizures and propensities to seizure, and also the medications that the dog is on. So certain medications, for instance, potassium bromide, has what we call a long half-life, which means that it takes a long time to equilibrate in the body, but it also takes a long time to be eliminated from the body. So because of that, if you're a little bit late on a dose of potassium bromide, it's extremely unlikely to make a difference because we don't see rapid changes. Really, the kind of the opposite side of the spectrum would be Keppra or levetiracetam, which has a relatively short half-life. And just for reference, the half-life of Keppra is usually 3 to 4 hours. The half-life of potassium bromide is 15 to 25 days. So you can see the dramatic difference. So if you miss Keppra and your dog has a propensity to seizure, then it may be very important that that dog needs to be on medications at a very strict schedule. So again, it depends on the medications, and it also depends on the dog. And unfortunately, there's no way to predict that except that we say try to keep on as close a schedule as you can, knowing that that's virtually impossible for most people, and try to stick to it as best you can. And if you'll unfortunately probably learn over time, what your dog will tolerate and won't.
And thank you so much. That I think that was a very great answer on that time frame, and talking about those half-lives I think are important, and that helps people understand those types of medications.
Yeah. One thing I'll add on that in terms of the daylight savings time question. So that comes up a bit because obviously you're gaining an hour or losing an hour, and now your dog's on a different schedule. So particularly if your dog seems to be predisposed to having problems, then what we suggest is slowly altering that. So maybe, give it 15 minutes if you're going back an hour, 15 minutes earlier one day, and then, go down to 30 minutes. And so you're not all of a sudden changing that hour. Most dogs, again, an hour doesn't make a difference, but there are some dogs that it will. And so it's probably good to adjust to that daylight saving time over a period of a week or so.
Okay. That does make sense. And I know that does happen. That question does come up frequently. And I'm just going to quickly bring this up because you did mention potassium bromide. There has been some information or chatter on the internet about it's rumored that there might be a shortage of that. Have you heard anything about that? I know that some caregivers are kind of worried about getting medications for their dogs with potassium bromide.
Yeah, so I'm not aware of that. And,
Okay.
there's two sources of potassium bromide. So one, if you get it from a compounding pharmacy, they're essentially just using a chemical grade reagent, potassium bromide, that they're formulating into capsules or into a liquid form. The other is a veterinary company that makes the product K-Brovet. And again, they're doing the same thing. So I'm not aware, maybe the potassium bromide reagent is in short supply, but as long as that chemical is available, then there should be a way to make it. But there's only the one company that's manufacturing the veterinary formulation, but compounding pharmacies can make it as well if for whatever chance that company is having problems keeping up with demand.
Okay, yeah, that makes sense. I saw that out there. And there are some ways that you can get medications through compounding, and then of course your regular pharmacies. And I have not heard of any different, but I know that some people were concerned about that. So we've talked about protocols and preparing a seizure protocol, and I know that was mentioned briefly, but can you quickly just give an example of what a typical seizure protocol that you might recommend just in general?
Yeah. So there's, the four drugs that we use most commonly are phenobarbital, potassium bromide, zonisamide, and then Keppra or levetiracetam. And there's not really one set protocol. It really depends on the dog's seizures, what the dog's overall health, what other conditions, and what's important to the pet parent. Are they mostly concerned about the seizures? Are they mostly concerned about the side effects? But I think ideally what I try to do is start with one medication and really maximize the use of that medication before adding in a second medication. Now, there are some people in a dog that's having bad seizures that will immediately start them on two medications. I personally don't do that because I like to see what one medication will do. And I think when you have two medications, you're more likely to have medication side effects. And then all of a sudden it makes it so much more difficult for the person who's giving the medication to go from 0 to 2 medications. But we really try to work with one medication, optimize that. If that's not working, then you start adding on additional medications. For dogs that tend to have cluster seizures, we do send home a rescue protocol, and that can vary as to what we do, but it's essentially something that the caregiver can give at home to stop the seizures and to prevent them from recurring, to hopefully decrease the likelihood that the dog will need emergency care at a veterinary facility.
And I will share just real quick on that. So with working with my neurologist, having that protocol is super important, knowing what to do after the first seizure, the second, the third, the fourth, and then go from there. So staying on your normal regimen, and then could you quickly talk about the importance of empowering maybe clients to talk to their primary vet about cluster buster, the terminology cluster buster medications, or having an emergency medication to avoid those maybe emergency visits as well. Because I know when I started, we just started on regular protocol medication, but I never had a conversation about cluster busters and emergency medications until a little bit further down the road.
Yeah, and I would say that's usually typical unless a dog comes in with cluster seizures. And the reason being is so the medications that we oftentimes use for cluster seizures are benzodiazepines like diazepam or midazolam. So that would be Valium or Versed, drugs like that. And those are controlled drugs. So from a legal standpoint, it's not something that we want to prescribe to every patient who may not need it. And then there's this controlled drug sitting in the environment. Not that we're saying an individual person's going to have issues, but just from an overall standpoint. So unless there's a reason to, and a lot of dogs will not have cluster seizures. They'll have individual seizures that stop on their own, and they don't need this cluster protocol. But if they do, then it's oftentimes involved some sort of benzodiazepine that you're going to give, either dripping it in the nose or inserting a red rubber catheter rectally and giving it rectally. Sometimes it's an injection in a muscle. So something you're giving. And then in addition, then that tends to stop the seizure over the short term. And then there's usually some other sort of medication you're giving orally that's going to try to prevent seizures from occurring over the longer term. And that can be usually repeated. We say it can be repeated 3 times in a 24-hour period, but not more frequently than once an hour, to hopefully stop seizures. If 3 times and it fails, then you need to seek emergency care at a veterinary clinic. But yeah, if your dog is having clusters and you don't have a cluster buster protocol, then I think that's definitely something to discuss with your veterinarian.
Absolutely. And that's exactly what happened in our scenario. Gibbs does have clusters. And so we were just kind of tweaking his protocol. And now since we know he does cluster 3 or 4 in a 24-hour period, we do start cluster buster medication after that first seizure. There is another couple questions about seizures before we go on to the next category. If a dog's seizures are controlled almost immediately once diagnosed, does that mean they will have a normal lifespan and their seizures will continue to be better controlled?
So most dogs, the good news is most dogs with epilepsy do have a normal lifespan. So that's definitely positive. And there's been studies that have shown that. In terms of control, we think that some dogs' epilepsy is programmed to be either bad seizures or good seizures, and it's probably breed related. So we know certain breeds tend to have more serious seizures and more clusters than other breeds. So I would say that, yeah, a dog that tends to have isolated seizures and tends to respond well to medication probably in general is going to do better than a dog that starts with cluster seizures and isn't responding as well. Although we do know that even though we don't consider epilepsy a progressive disease per se, and that there's something in the brain that's growing or like that, we know that seizures can change over time. And we expect, like, even if a dog responds to one medication, that medication may not work for the dog for its entire life. And adjustments are oftentimes needed, or changes in medications can be needed.
I'm glad you mentioned that, because just knowing it's not a progressive disease, because I think that comes up in conversations a lot, thinking that it won't get worse and worse and worse. In fact, sometimes dogs can, get better. But knowing that the brain changes and that it's okay that you have to change medication doesn't mean that the disease or condition is progressing. So I think that is important to point out. Someone had also asked, is it better for a dog to be having more seizures further apart or more mild seizures closer together?
That's a tough question. I don't know if one's better than the other. Yeah, I'm not sure. It really, depends. We always would rather see what we call a mild seizure, a focal seizure, rather than a generalized seizure, just because we know a generalized seizure involves the entire brain. So there's potential damage or effects in the entire brain versus a focal seizure involves a small area. But what is better or worse for the dog over the long term, I think that's kind of difficult to say.
Right. And I know that it's been talked about a lot about the immune system and seizures, and that gut brain relationship. I know there's probably a lot of research that's still out on that subject. If you can touch on that for a moment.
Yeah, so I think the gut-brain axis and the effect of the GI tract and the bacterial microbiome that is in it affects on pretty much the whole body is really an area of expanding research. And, we know that the gut can affect diseases like heart disease and diabetes and, joint disease. And more recently, it's been looked at in terms of brain disease and, things like in humans, anxiety and Alzheimer's and Parkinson's disease, and more recently looking at epilepsy. So we really, at this point, there's some early research in human medicine and in laboratory animals that says that the gut, the health of the gut microbiome can impact epilepsy, and by altering that, maybe dogs that have or individuals that have bad seizures may have some alteration or dysbiosis. We don't have that information yet in dogs. In fact, we at NC State, we're just wrapping up a study that was sponsored by the AKC Canine Health Foundation, really trying to determine whether dogs with epilepsy do have gut dysbiosis. And we compared the gut population, which you look for in fecal samples from epileptic dogs to healthy non-epileptic housemates, because you have to control, the gut bacteria is also dependent on environment and what animals eat and if they're on other medications. So we are just wrapping that study up. We just finished recruitment, and hopefully we'll have results from that study within, I would say, the next 3 to 6 months.
Oh, that's exciting. And I know I've shared surveys that you guys have put out before and participating in those. So it's important to, for that research, because I know it starts with the human and then it kind of trickles down into the canine world. So it's important to have that research because it does take years for that to finally come to fruition. We had just one more question on seizures before we go to the next category. And that is, I know every dog has a different trigger. There's been a couple special incidences from as regarding, say, have you ever heard of a dog being triggered, having a seizure due to having urination or bowel movements? And we have one person out there that she feels like her dog has a seizure every time around this elimination, as well as, so I don't know if you've heard anything about that, or like an environmental trigger or something that could maybe guide her in the right direction.
Yeah, I don't have anything specific, although what I can tell you, from studies that have been done, I think in general, the biggest trigger that we've seen environmentally is stress, any sort of stress situations, or in humans, we know it's sleep deprivation can cause it. So, if there's a situation which is stressful, for instance, I think the common one we see is particularly around the holidays when, there's a lot of activity in the house and new people come and visit, and dogs tend to have seizures then. There'll be about seizures, dogs that go to the groomer may have seizures there. So that's the biggest trigger. So if somehow, I've never heard specifically about eliminations, but somehow if there's some sort of stress associated with that, that could be the cause.
Okay. That makes sense. We're gonna talk a little bit about medications and not get into any more, super details. But one that was in the chat box that we noticed is is there a difference or preference of compounded KPR versus K-Brovet?
Yeah.
Or
yeah. So I would say no. So if it's compounded, then I think they're both compounded. So the K-Brovet is compounded, it's being compounded by this company that's marketing it.
Right.
So I think either is acceptable. You know, K-Brovet, I think is very convenient. It comes in tablets, it comes in liquid formulation. A lot of the compounding pharmacies will either make a liquid or a capsule.
Mhm.
But I think both are fine. So I personally don't have a preference. At NC State, we have a large pharmacy that compounds our own medication. So we use our own compounded formulation. But for people who don't get it through our pharmacy, I will prescribe the K-Brovet as well.
Okay. There has been a few having concerns about rear hindquarter strength in medication side effects such as potassium bromide, and the best way to maybe help gain that strength back again or help with that unstableness.
Yeah.
If there's any suggestions.
Yeah, and that's probably the most common side effect that we see, sedation and unsteadiness. And the unsteadiness tends to manifest in dogs and their back legs. And the reason that is that, we know that seizures are due to too much excitation and too much talking of one neuron to another, one brain cell to another. So the drugs work to kind of dampen that. And when they dampen that, they can't just dampen the seizure, they tend to dampen the whole brain. So one of the side effects we're going to see is some degree of sedation and some degree of unsteadiness on the feet or ataxia. And some dogs, it's more tolerant than others. Every drug causes it. So when you get more drugs on board, you're going to see it more often. And unfortunately, there's really nothing we can do to combat that except reduce the medications. And if the medications are controlling the seizures, then most people feel like the unsteadiness is better than the seizures. So I usually say, encourage your dog to continue to exercise to keep the strength up. If you want to try some physical therapy, I think that would be fine. We've had some dogs that have had arthritis in their hips or whatever and have also been epileptic and have had quite problems that have gone through physical therapy. And again, it just keeps their strength up, it keeps their mobility. But there's nothing we can do, unfortunately, specifically for that. It's just a side effect of the medications.
Okay, that makes sense. Is there any, I know that cold laser therapy has been mentioned a few times. Is that specifically more geared to help with the strength or maybe arthritis?
Yeah, I'm not as familiar with cold laser therapy. So I would say probably, I'm not sure, but I would suspect it's probably more helpful for the arthritis.
Okay. And cluster buster medications, I know one of mine is clorazepate. And I know there was a question in the chat about how long does it take the clorazepate to work? And, I know there's clorazepam as well. Is there a preference? Again, I know it's probably unique to each dog, but those are, yeah.
Yeah, so and clorazepate and clorazepam, so what they are, they're just longer acting and things that we can give orally of the group of the benzodiazepines, like the diazepam and the midazolam. So some people will choose to use that to help. And again, you're giving it orally, usually to help prevent another seizure from happening. And whether you use that and which one, it really depends on what other drugs your dog is on and what your veterinarian is most comfortable with. People will use that. People will sometimes use the immediate release Keppra for the same thing. So if a dog may not be on immediate release Keppra, they may give additional doses of immediate release levetiracetam during clusters. Some people will just recommend giving additional doses of the standard maintenance medications. So there's a lot of different ways to approach it. There's not kind of one right one, but rather it's really an individual decision based on a lot of factors surrounding the animal and its lifestyle and its owner.
So if your typical regular maintenance medication, say you're maxed out on the highest dosage that's safe for that animal, say your highest dosage of Keppra and zonisamide, does it make sense to continue to use those as cluster busters, or would that not make a difference? And that's why you would go to a different one like clorazepate.
Yeah, so if you're maxed out on the dose, then that might be a reason when you might give something else. And again, there's a lot of variables. So, do seizures tend to occur at a certain time where you may be maxed out at the dose when it reaches its peak, but maybe at the trough it goes down, and then they could benefit from other medications or additional doses of the medication. So there's a lot of factors that play into that. But I would say in general, if we don't feel like giving additional doses of that medication is going to work, then that's when we're definitely going to use something else.
It makes sense. You did mention just a minute ago about trough and peak. Is that something that you guys use when you're testing their blood?
Yeah, right. So when we're testing blood levels of medications, and we do that regularly for phenobarbital and potassium bromide, it's done sometimes for zonisamide and levetiracetam. And for certain drugs, we really don't care what the peak and trough is. For instance, bromide, because bromide equilibrates and takes such a long time. You can take a sample anytime during the day. If you're concerned about the way a dog may be metabolizing the drug, and particularly if you're concerned that maybe the levels in the blood system are getting low towards the time of the next dose, then it might be helpful to get peak and trough. And the trough is taking a blood level right before a next dose of medication. So that may tell you how low is the concentration of the drug in the blood getting, which tends to reflect the concentration in the brain and the seizure control.
Thank you for making that connection and connecting the dots on that, because I think that's a very common question as well. Also, people want to know, are their dog in any pain when they're having a seizure? And I think,
So we of course don't know what dogs are feeling. All we can say is kind of extrapolate from what we hear from people. And people don't report being in pain during a seizure. People don't really report remembering much about their seizure. By all means, there can be some discomfort after a seizure. If there's a lot of muscle activity, there can be muscle aches and kind of soreness from that. In people, we're always concerned because of people being upright if they fall. People who fall during a seizure can have serious injuries. Fortunately, we don't see much of that. But I think if we're extrapolating, and if dogs are the same as humans, which we have reason to believe they are, I don't think they really feel pain during their seizure. I don't think they remember their seizure. What they may feel is some discomfort after the seizure, particularly if they tend to have severe seizures and a lot of muscle activity. And, dogs that may bite their tongue or something like that, there may be soreness from those manifestations afterwards.
And there is also another question about activity and possibly some correlation about keeping your dog active, mental stimulus, whether it be puzzles or agility, therapy, or some sort of training and socialization for your dogs. We kind of think about that as humans, as you get older, they say do brain exercises to help, ward off potential dementia or what have you. Do you feel like that can trickle down also to the canine world of, getting out and doing things and being active with their dog instead of being fearful?
Absolutely. Julie, do you want to address that?
Sure, I would love to. So there's actually kind of a growing body of interest in this whole area, both for just general cognition across the lifespan of a dog, but then also with any dog that is impacted by neurologic disease such as epilepsy. I think that there's a huge benefit, from birth to death in keeping our animals engaged and interactive as much as we can, and both for many different reasons. So we talked about medications. Of course, one of the side effects we know about medications in some of them is that increased appetite or decreased satiety. So puzzle games, being able to engage a dog in a food-driven puzzle, hide and seek, whatever, all of that we know from the nutrition side can help with satiety just in general, because they're not just eating this big old meal from a bowl in 2 seconds, right? A lot of these dogs are big dogs, and if they're like mine, they just inhale the food and then they're looking for more. So the more that you can just engage that, one, slow them down and let them chew, but two, increase kind of that cognition around whatever that activity is. Over the years, you're really going to hopefully be able to continue to maintain their cognitive function, keep them just happier. They're not bored. They're involved in things. There's some really great links. Part of my day, actually, I work with the nutrition service as well, but we've created a flyer that's on the NC State nutrition site, but really that interactive feeding. It's growing in popularity as far as options. There's many different products out there that you can buy commercially, or there's great ideas on YouTube as well. You just have to, of course, be careful. If you have a big, strong chewer, make sure that you get items they're not going to destroy. But I'm a huge advocate, not just for EpiDogs, but absolutely for EpiDogs. It, is really increasing those opportunities for them to enjoy life. It really comes down to that: enjoy life, learn, and interact. And so you mentioned also like agility or things like that. Might the drugs affect them, and may they be able to, sometimes we have to change our thought process. So our dog may not be an agility champion once he's, diagnosed, but he might be, you never know. But there might be hours of that day, for example, the first couple hours after you give medications, where you may or may not want to choose in higher level activities, because there may be a difference in their abilities to manage that, or just reduce the activity but let them still do it. So again, in a lot of different ways you can incorporate it. But absolutely, I think that this is really I really enjoy this area. I think it just, there's beyond the epileptic and cognitive benefits, there's just so many ways that it allows us to just interact with our pets and have fun, and they have fun and reduce that boredom. They stay moving. So again, even that hind limb ataxia, and now you've got them sitting and standing and doing some different things that'll help those muscles, both their brain muscles as well as their hind limb muscles. And, I think you'll have a lot more fun too. I mean, I enjoy that type of activity with my dog a whole lot more actually than crossword puzzles. So
yes.
Thanks.
Yeah, and we found one with a squeaker. So I had an interesting conversation with Rick from the Wally Foundation, and we have noticed that, and I don't know if this is across the board, it seems to be like our epi dogs seem to be extremely not more intelligent than normal, but it just seems like they just are thinkers. I don't know if you've seen any correlation with their aptitude or their something across the lines of just being more trainable or something. I don't know, maybe it's something to do with the brain, or if you've seen any correlation with that.
Yeah, there's actually been some studies that have started to look at that. And the problem has been with the studies is that they tried to look at the cognitive function of dogs with epilepsy, but a lot of these dogs were already on medication. And they found that the dogs with epilepsy actually didn't do quite well in these trainability type studies, but they didn't know how much was due to the epilepsy or how much was due to the medication. So really, to look at that question, we would have to have dogs with epilepsy before they were put on medications. And that those tend to be harder to find, particularly the dogs that we may want to study that have pretty serious seizures or epilepsy, because those dogs tend to go on medication fairly early on in the course of their disease.
Thank you. Sorry. Can you talk a little bit about IMHA?
I'm sorry, about what? I didn't hear what you.
I'm sorry. Okay, they want to play. IMHA, that has been kind of trickled out with some of things that people have questions about regarding side effects of certain AEDs, and so I don't know if that's something that you can
Yeah,
quickly.
so IMHA, immune-mediated hemolytic anemia, is something that we see, again, it's kind of an immune disease. We can see it, what we actually see more commonly with seizure medications, and predominantly phenobarbital, is bone marrow suppression. So it's not necessarily due to, there's a little bit of, are the cells, it causes an anemia or low platelets or low white cells. It's not really due to them being hemolyzed or destroyed. It's because they're being suppressed and not produced in the bone marrow. And that's what we consider an idiosyncratic reaction to phenobarbital. So it can happen really at any dosage, but tends to happen early on in the course of treatment. And it's reversible if you stop the medication. So I know there's, some thoughts about IMHA and dogs that can develop that. And there's not a strong, I guess, correlation between medications causing that, although, we're concerned when an animal has IMHA or any sort of immune disease, you're always wondering what that immune stimulation is. And oftentimes we just don't know what it is.
Okay. There have been a couple of questions around phenobarbital, of course, and cause of weight gain, maybe increased incontinence, and there was even a question about affecting the eyesight, lines of sight. Is there any new research about any of that, or can you speak on that?
Yeah, so we know that phenobarbital causes an increased appetite, increased water consumption, and increased urination. So probably and the increased appetite, we see pretty consistently. So it's not uncommon for dogs that are on phenobarbital to gain weight. And it may not be that they're eating more food, but I think it's a combination of having increased hunger. So maybe they are eating a little bit more food. And then because of their ataxia and sedation, they may not be exercising as much. So just like us, more calories in and less calories being burned is going to create weight gain. So I would say it's pretty typical for dogs on certain anti-epileptics, phenobarbital being one, potassium bromide as well, to tend to gain weight over their lifespan. In terms of the incontinence, so if we have let's say a female dog that's already prone to incontinence and they're drinking more water and having to urinate more, then that may very well be. So it's probably associated with the increased water consumption, increased urination in a dog that has some incontinence, and the sphincters of their bladder aren't completely competent to begin with. The eyesight specifically, I haven't heard, but I would say that could be a possibility too. People put on seizure meds may talk about blurry vision, or again, has the medication is kind of dampening those brain signals. It could dampen the clarity of visual input that's coming to the brain. So I would say that would be a possibility as well.
Thank you for that. Makes sense, very logical as well. You do see a lot of questions out there about flea and tick medication and heartworm. Do you want to say a couple words about that?
Sure. So I am a huge proponent of using flea and tick and heartworm medication. And maybe that's because I live in North Carolina and we have a lot of heartworm disease and we have a lot of fleas and ticks. And I've seen dogs that can have very serious disease from those. We also know that there's definitely, the FDA put out a report not that long ago of a certain class of flea and tick medication that can
that is Gibbs's mom's putting this thing on. I've been sort of able to do it, but not.
I'll try to mute her.
That's all right. So there's a certain class of flea and tick medications that the FDA has sent out a warning about seizures. But we have a lot of epileptics that are on those medications. So I will say, use a flea and tick medication, maybe avoid this isoxazolide class of medications, but use something, and heartworm as well. If you think that, a lot of people say, well, I think that my dog has seizures after the monthly heartworm medicine or after the monthly flea and tick medication. And that is a possibility, but what is also a possibility, and I've probably seen more than the seizures, is that the dog tends to be on a natural 30-day cycle. And the seizures just happen on the same cycle as the giving the medications. So what I'll oftentimes say is, okay, but let's give the medications. If you're giving it on the first of the month and your dog tends to seizure like in the first week of each month, give the seizure medication or the flea and tick and heartworm medicine in the middle of the month and see what happens. Now, if there's a strong correlation, then I think you can say, let's not give it. But most of my patients are on flea and tick medications and heartworm medications, and they do quite well, and it doesn't worsen their epilepsy, and there's no association with giving them. And I feel better because they're being protected from those parasites that can cause significant problems.
Right. And with heartworm, I know that's especially important. There's not as much correlation with heartworm as with seizures as there is with flea and tick. And there's natural, treating your yard, obviously, if you're not in a very heavily wooded area. I think it's going to be obviously the area that you live in. So maybe a city dog may not be need as much, but yet, like in a wooded area. So I know that there's been, natural, peppermint oils and things you can do, other ways that there is. If you do find that your dog is having seizures after those, there might be other natural things that you can do. But trying to keep that journal to see if you can make that connection.
Right. And the journal, I think, is very helpful in that regards. And people will ask, like, how soon after the medications would I see the seizures? And it would be quite soon. So probably within 24 hours. So if your dog's having a seizure 5 days later, probably not the medication.
That is good to know. Very good point to make. There are, speaking of oils and aromatherapies, and is there any, I know Jean Ann had mentioned frankincense, something that helps with seizures. I know there's rescue remedy. There's things out there that maybe, do you find there's not a lot of clinical evidence about that. And I don't know if you can speak a little bit about supplements on both ends of trying to avoid certain aromatherapies and then using some to help after a seizure occurs.
And there is really, like you said, not really much, if any, clinical evidence in that regard. So we don't have really evidence-based data to say this is what you should do or shouldn't do. There is some early data that talked about essential oils, and that's where the idea that you should avoid rosemary came from, is that essential oils in strong concentrations can cause seizures. Not as much work as to what may help alleviate seizures or calm animals. By all means, a lot of people use the box rescue remedy. There are some traditional Chinese medicine type therapies that people are using. Again, not much data or evidence to support those, but there are some of those that are advocated as well.
I would like to just add one thing here
Sure.
as well. Just on that, there are like pheromone type, like Adaptil, which is a calming that is approved in veterinary medicine that may be helpful.
Julie, how do you spell that? Do you know?
The brand name is ADAP.
Okay.
But I'm not endorsing it, but it is
Right.
one that's used in veterinary medicine. And for felines, it's Feliway.
Okay.
But they're kind of used more in the fear-free, just general calming area. But I would just like to add that some of the over-the-counter and or more commercial plugins, scents, etc., they're starting to see some early evidence of some challenges in some pets. So just a very cautionary tale to be very careful about what you're plugging in and using for aerosol in your home, because a lot of them may be liver toxic, not only to your pet, but to yourselves as well. And so just a note, there's not one particular brand, but just be very careful in that arena, because in anything inhaled, especially in our dogs and in ourselves, but their concentration is going to be that much greater because again, they're scent based. So.
Okay. I appreciate that because I know a lot of people do use, there's a lot on the market about pheromones and calming. And so just be conscientious about that. And of course, us humans using essential oils, which is important, for our own well-being. And then thinking that does, that may affect your dog as well. So there was one question about static static seizures and how often. It's our worst fear, obviously, one of mine. And can you speak to a percentage? Is it kind of more that rare thing, and or just give a little insight about status in general?
Yeah, I would say fortunately, status epilepticus in dogs that have idiopathic epilepsy, which is I think mostly what we're talking about, is relatively uncommon. There's studies that have shown that there will be a fair percentage of dogs that will develop status epilepticus kind of at least once in their lifetime. It may be associated with missed medications or, other stress or such. But it's not, I think, again, the good news is that most dogs with epilepsy will live a normal lifespan, and we don't see many dogs that end up succumbing to status epilepticus and the serious consequences that they have. So it's definitely a concern, and that's why we treat, is really to avoid status.
Right.
But it's not something that is inevitable.
Right. And with preventing status, and then of course other cluster medications, and then I know a lot of people we've been using Keppra to kind of prevent as their cluster buster. And there's two different Keppras, extended release and the regular, I guess you would say. Is there a preference? Is there more one consistent than the other? Is there a difference maybe in the control of seizures versus using one or the other medication of Keppra?
Yeah, so I think the one that we know more about is the immediate release, or the regular Keppra, and that's the one that has to be given 3 times a day.
Okay.
So a lot of people have problems giving 3 times a day. So particularly in larger dogs, we'll go to the extended release, which is twice a day. The one thing you have to remember about the extended release is the extended release formulations come from the coating on the tablet. So if you crush or break that tablet, you're negating the extended release effects. So you can't give like 2.5 of the extended release tablets, because then you're not giving extended release anymore.
Okay.
And there are some dogs, and I'm not sure why, but I do have some of my patients that actually did well on immediate release. We changed them to extended release. They didn't do well. We brought them back to immediate release, and they do well again. So in my experience, there are some dogs that do better on immediate release than extended release. But of course, the convenience of giving twice a day instead of 3 times a day medicine is great. So I think it's reasonable to try the extended release if you have a dog of the size that the dosing will be appropriate.
And I have seen that a lot too. I've actually had a few friends that had went back because they did notice a difference with their dog. They also, were on many medications like zonisamide and phenobarbital and potassium bromide, and they thought, well, can we back off on the Keppra? And because it's one of the least ones, or the ones they started, and some did well with that, and some did not. So I don't know if you've seen any of that when you start removing medications, if you see a trend in one over the other.
Not really. And when we have good control or we have bad side effects and we're deciding which medication to stop, I really have a conversation with the pet parent and say, well, what medication do you think has been the most effective in controlling your pet seizures? And what medication are you most concerned with in terms of side effects? And based on that, I'll decide which one to go back on. And that's assuming that I don't have any reasons from a medical standpoint to decrease a medication because of side effects that I'm seeing. And then you just have to go slow and see. But yes, sometimes they need the cocktail of how many medications it is. And when you start decreasing one, you're going to see an increase in seizures. Other times you can be successful, and it doesn't necessarily have to be, the first medication or the last medication that you pick. And if you're adding drug number 3 and you start seeing sedation, that doesn't mean that drug 3 is causing the sedation. You can maybe decrease drug number 1 and get an improvement in sedation because they're all additive. So that's something to remember too. If you've just seen all of a sudden a side effect, that's an additive, a side effect like sedation or wobbliness of the legs after you've added your third medication. That doesn't mean that it's completely associated with that medication, but rather it's probably additive from all of them. So if you're able to decrease one of the other medications, you may get improvement in the side effects.
Okay, thank you for that. I know we're approaching the 2 o'clock hour, and I do want to get Wally Foundation his little 3-minute segment in there that we recorded yesterday, since he wasn't able to be with us today. And I'm gonna left the last one as a doozy because it's a trending question. It seems like that's been CBD has been a question for at least my searching. So can you maybe touch on that subject for a couple minutes?
Yeah. So I guess I have to preface it by saying I have not used CBD because,
Okay.
again, CBD is not legal for me to really even discuss with my clients in the state of North Carolina.
Okay.
Because they consider it a illicit drug, a controlled drug, so a regulated drug. But there are places where CBD products are legal for humans and animals where they're doing studies. And the place where they're doing the most studies is at Colorado State University. Dr. Stephanie McGrath has been doing some studies, and her studies are still underway, but I think they have shown some promise. The one thing I caution people is, there's so many sources of CBD, and, CBDA is not the same as CBDD and, Z and P and whatever. So they're all so different. And they're very different potentially in the way the dog's going to absorb them. So if a study comes out and says, oh, look, the CBD works, that doesn't mean that the CBD you get from your corner store is going to work the same as this one that they studied. And by all means, there's a human product that is CBD that works quite well for certain types of epilepsies in people, but it's phenomenally expensive. But I don't think we can extrapolate those results to the CBD that we can get other places. So I say, if you want to try CBD, that's okay, but we don't know if it's going to work unless you have a specific type where the studies have been done that have shown that it is absorbed from the intestinal tract of dogs. And the other thing we need to worry about is, can CBD interact with some of the other medications that the dogs are on? And some early work out of Colorado says that CBD can increase liver enzymes as well. So if you have a dog that's on phenobarbital, or you have a dog that's on zonisamide that are metabolized by the liver, CBD could potentially cause some problems that we just don't have the experience right now. So on that, I would kind of say in general, stay tuned, because I think we'll have some information within the next probably couple years. Okay. But for people who want to use it now, I say just use it with caution.
Do you have a rule of thumb about the quantity?
Because I don't use CBD, I don't have, again, and I can't even be having a discussion on you to say, oh, you should use this amount, because technically that's not allowed by the North Carolina Veterinary Medical Board, which oversees my license. So yeah, we can't have conversations at all like that. I can tell owners, if you want to get it on your own, that's fine, but I can't make any recommendations. And because of that, it's not that I'm withholding the information. I actually don't have that information because it's not something that I use, but I'm sure other people could provide that for you. And again, if you went to Stephanie McGrath, she's a neurologist at Colorado State University. She's the one that's done the most research, and she's published some papers. So there would be some data available through, I'm sure, through her or her website or her publications.
Stephanie McGrath. Okay. And that's, because I get that question a lot. And so I don't personally have any information, or we don't use it as well, but I know that it's a very common question.
Yes, absolutely.
So I appreciate everybody's time. I hope that you guys can stay on for a few minutes to hear Rick tell us a little bit about the Wally Foundation. I am going to go ahead and share Rick's video or a little clip that we did last night.
Okay, thanks, Tracy. Well, as you know, my name is Rick Selwood. I'm the founder of the Wally Foundation. We started the Wally Foundation, it'll be 10 years next year in 2023. The reason we started it is that our family had a St. Bernard who had epilepsy, and unfortunately he died at 5 years of age. And we sort of felt that it was a meaningless death, that we needed to do something about it. So we thought, in a small way, we might reach out and help some other owners of epileptic dogs who couldn't afford medications or medical treatments. And that's what we started doing. And before long, the Wally Foundation took off. We are now, as I said, we've been going on 10 years. We have a board of directors. We have awesome volunteers. We have people that we consider ambassadors that can work with people who are first-time epileptic dog owners. Sometimes people don't need money. They don't need help with medications, but they need information or just someone to listen to. And that's what our brand ambassadors do. Everything we do is volunteer. All proceeds we give through fundraisers, donations. Everything goes 100% back to our recipients and the dogs. We use no money for salaries. All of our expenses are paid by us as individuals. So we want to help as many people as possible. To date, we've helped over 250 people over these 10 years. And it's hard to put a dollar amount because of what we do, but we've spent well over $100,000.
Wow.
And that's between giving people cash assistance or medications. With medications, people whose dogs change a medication who may have passed away, they donate their medications to us. And in turn, we can provide owners with medications. In many cases, we can give them 90-day supplies of medications that are several $100s out of pocket. And we give this to them free of charge.
Right.
Other people we help by contributing to medical bills. Perhaps they've been paying for their dog's medications and treatments, and they've fallen behind on their property taxes, things like that. So we can help pay those. We do not give money directly to any applicant. We'll pay a bill, we'll pay a veterinarian, we'll pay a pharmacy. We don't give cash to anybody. We also have very stringent regulations about who we approve based both on their income. We focus primarily on low-income individuals. And we have to have verification of all medical needs by their veterinarians before we'll even proceed. And we're hoping that with this 2023 being our 10th year, we can look forward to many more.
All right. So we did it. It's 2:05. We got everything in. And I would now like to open up any other conversations that or burning questions, or just if you want to network, or if you want to provide your information in the chat box, you know, we can stay on. I can stop the recording if people are more comfortable with that, since we're done with our session. So I think I'll go ahead and do that. We covered almost every single question, and we did group some together. 40 questions in less than 90 minutes, which averages, if you do the math, about 2 minutes a question. Fabulous work. And we will have more sessions. We do Whine and Wag once a month, not with these veterinarian experts, of course, but which I think this is great. Just prompt to, it's not like you're preparing a presentation. We're just having conversations. And we can make this look and feel different each time. So I appreciate you guys hopping on. I know you're extremely busy, but we do appreciate you know, the education, the knowledge, the awareness, and everything you're doing for the canine. Thank you, everybody. If you have to jump off, thank you for participating in this Whine and Wag special talking about canine epilepsy event.